So BVD, it stands for binocular vision dysfunction. It's this very important skill set that all of us should have. And the binocular vision dysfunction is a dysfunction of that. So it's this inability for the two eyes to coordinate with one another, to align with one another, and then track, and then bring in the same kind of information from two different perspectives, and then have the brain process it and fuse it into a single image, single 3D dimensional image, and then help you navigate the world around you using these senses. But with
Dr. David, great to have you on the podcast.
Nice to be here. Thank you for having me.
Totally. Just dive into BBD. I think that's not a common thing most people know about. Can you help explain us about that?
Absolutely. So BVD, it stands for binocular vision dysfunction. It's this very important skill set that all of us should have. And the binocular vision dysfunction is a dysfunction of that. So it's this inability for the two eyes to coordinate with one another, to align with one another, and then track, and then bring in the same kind of information from two different perspectives, and then have the brain process it and fuse it into a single image, single 3D dimensional image, and then help you navigate the world around you using these senses. But with binocular vision dysfunction, small things such as alignment issue, like a misalignment of the eyes, a focusing issue where one eye is not focusing enough, the cranial nerve issue where the eye is not able to kind of pull in the same areas of gaze. Anything that happens in one eye even can create this mismatch between the eyes and create this dysfunction in the binocular vision system and create all kinds of horrible symptoms that unfortunately go undiagnosed and untreated most of people's lives. And that's the whole point of the awareness, the social media accounts and the videos, is to spread awareness of this issue, because a lot of people are suffering from it and not getting any kind of help.
And how did you originally go down that pathway as somebody who studies the eyes?
Sure. So I myself have binocular vision dysfunction, and I've had it my whole life since birth. Mine's a genetic component, and I've dealt with these symptoms up to 30 years old, where I was in optometry school and I kind of discovered this issue in myself. However, my whole life for 30 years, it was missed by every single one of my eye doctors. So I had seen 4 different eye doctors, and every single one told me, your eyes are perfect, you see 20/20 in each eye, the ocular health, the retina, everything is great. Whatever you're experiencing, whatever symptoms you're experiencing, it's not from your eyes. It's from your brain. It's from your some other thing. And then in optometry school, at the end of optometry school, right before graduation, dealing with all those symptoms and all those difficulties in college and optometry school, in the binocular vision clinic, while seeing another patient with binocular vision dysfunction, it hits. It just clicks in my head. As my patient, she was an 8-year-old girl, I'll never forget it. She's talking about her symptoms, and she's telling us, and with a group of doctors, almost doctors, we're trying to evaluate her, and she's like, I get headaches, I get dizzy, I'm getting nauseous, I'm losing balance randomly, I skip lines when I'm reading, I'm losing my place. And then I kind of zone out. I dissociate from the whole evaluation. I'm like, that sounds a lot like me. That sounds a lot like my childhood, my life. And then most of the evaluation from that point, I couldn't even concentrate and focus, because I was like, oh my God, do I have this issue myself? And it was missed by every single one of my eye doctors. Yeah. And right afterwards, I do the test on myself, and I see the findings, and it just, my heart sank. And once I tried the correction, it was just mind blowing to me that my 20/20 vision meant nothing. It was completely, absolutely nothing relative to what I was seeing with that correction. So it just, took my passion on a whole different level, and I just got obsessed in the field, and just trying to figure out my own life, why I had those difficulties, why I had those struggles, despite having straight A's, and really I felt like I was working harder than most of the people in my class, and it was just, I understood in time that it was because of these visual issues that was missed and undiagnosed by every one of my doctors. So that's how I got into it, correcting it myself and changed my own life, and then got obsessed.
That's quite the story that you got back there behind why you do all this. And from what I understand, eyes really are just a extension of the brain, and most of our real estate, brain real estate, is because of the eyes, and they play a vital, important, and role in just healthy living. And so, with BVD, um, what are like some amazing stories that you've seen by working with the people like that have changed their
Oh,
lives?
I have so many. I literally see it daily. I see the changes daily in our practice. And when I was doing it in the beginning and I kept seeing these things, I'm like, oh my God, I can't believe nobody knows about this. I can't believe people are just walking around dealing with these symptoms and nobody knows about it. And then we're able to correct it and then seeing patients back and seeing all these life-changing experiences. I was like, oh my God, I gotta talk about this. I gotta go on social media and like talk
Yeah.
about it and spread awareness of it. So the changes I've seen, I mean, we've seen patients go from home, being at home, completely agoraphobic. They can't even step outside their door to they're driving now. They're going back to school now. I have patients that have dropped out of school when they were younger. Now they're going back into medical school. It's insane the changes I've seen in patients just by correcting these visual issues that's missed by every one of the doctors that they had seen. So it's truly incredible. Like I've had patients with full-blown panic attacks and anxiety attacks on multiple medications where we're treating this issue. They got off all those medications and now they're living their life. I've had patients with they've been on migraine medications for 30 years, and after correcting this issue, they stopped using their migraine medications. They didn't need to. And I actually have many of these patient testimonials recorded by my actual patients that I've seen. And they just come back for the follow-up, and I ask them, hey, do you want to share your experience with a correction? And they're more than happy to share because they themselves start seeing these issues in people around them. And they want to help me spread awareness because they're like, yeah, I want other people to experience this life-changing thing that nobody knows about. So I've seen really wild stuff happen.
That's awesome. That's amazing that it's turned into a mission for you
Oh
and
yeah.
be able to spread this awareness. And I've seen a lot of your content. It's super powerful. Um, what percentage of people that have concussions typically have BVD?
So I believe research shows that at least 75% of people with concussions have binocular vision dysfunction. And when you learn about binocular vision, there's so many components to it. But like doctors typically evaluate one out of the like 17 components that you would need for the vision to function perfectly. So 75% of people with concussion can exhibit these binocular vision dysfunction symptoms, and it all has to do with the brain. 70% of the brain is responsible for processing your vision and the sensory and the motor component of it. And then you have 6 cranial nerves that are controlling your eye movements and your eye muscles and your focusing. And then you have 12 extraocular muscles and 2 intrinsic muscles that are controlling your eye movements, your focusing function, depth, etc. So if only one of those components goes off, you have a problem. You have a binocular vision dysfunction. Now the brain, the muscles, the nervous system has to constantly try to figure out how to deal with this issue. So it creates these compensatory mechanisms like a head tilt, like a body tilt, and like eyebrows wrinkling and kind of frowning, all kinds of weird type of mechanism that the brain comes up with to deal with these issues. So yeah, and like if I see a patient and they say I've had a concussion, I know the first thing I'm looking into is binocular vision dysfunction.
Wonderful. And when it comes to not fixing this, that's not the right word, but obviously
Treating.
number one is going to see you in person, obviously, and getting lenses and things of that nature. But what are some things that people that may not be able to do that can do right now to just improve their vision?
Sure. So, with the concussion, kind of, we're talking about how it can affect the extraocular muscles and the cranial nerves and throw the eyes off alignment. So, with the correction that we do, is through lenses, it's through vision therapy. But let's say people have no access to seeing a doctor, seeing a specialist, or doing the therapy done. There are some simple things that can be done at home. to help deal with the symptoms. So things that can kind of relax these overall areas, so facial tension, muscle tension, or even calm down the nervous system, things in that of that nature. So things like meditation, things like massages, like forehead massages and around the eyes. Heat does amazing things in these areas to relax the muscles, spread the fibers, and causing relaxation. And then simple eye exercises, and I do post that on our social media as well. And I know you post it as well. And things like they don't even require a lot of tools. You can use things that you find around the house, and not even you can use your own hands to do these exercises. So I teach my patients simple exercises they can do at home, like saccades, looking from one point to another point in different directions of gaze, horizontal, vertical, diagonal, pursuit eye movements, the vestibular exercises that we know of. And if like all that fails and they're still symptomatic, covering an eye. When you cover an eye, it breaks that connection between the two eyes, and then now there is no kind of tension and pulling in the muscles because the brain is constantly trying to fuse these two images that you're getting in from the information. So covering that eye eliminates that need for the brain to fuse the two and calms down the nervous system, the muscles, and things like that, which in fact is a very common compensatory mechanism that a lot of patients already do right off the bat. It's like one of the symptoms. It's one of the things that I talk about in social media videos, is like, how do you know you're dealing with this? Well, you start covering one eye subconsciously, and that's your brain trying to deal with the issues. Like I have people and patients telling me that, by the end of the day, they're on their phone and they're like this. They're driving, they start closing one eye. My own friend, every time we drink a couple of shots, he sees one eye closed. I'm like, you're feeling it. And yeah, it's these simple things that can be done, but again, none of those really truly get rid of the problem, because if it's not corrected, the brain is constantly figuring out how to compensate. So the second you open your eyes, you compensate, and it's cumulative. It does not get better on its own. It just gets kind of worse. Things get stabilized, but now the brain has all these weird mechanisms that's using to compensate for it, but it never really goes away on its own.
It's so interesting. I saw some research a while back that said most of eye and vision is subconscious, and I think that was fascinating because I wish I had exactly who did the research, but basically 5 to 10% is conscious from our primary visual field,
Right.
and the rest is subconscious. Can you nerd out a little bit about that?
Yeah, absolutely. Yeah, a lot of our vision, we can control it. That's what vision therapy is. It's like teaching the patient how to control it, but then getting it into the subconscious level. So a lot of these visual functions are autonomic. It's in part of the autonomic nervous system. You see in your field of view, you turn your head, you turn your eyes. The main thing, right, trying to look out for danger. And maneuver and feed ourselves and take care of ourselves pretty much. So with our eyes, if our brain is working on just trying to perceive information coming into it, everything else goes. So now you're unable to process any other sensory information, auditory, speech, talking, cognitive, right? So it's just working nonstop on this part. So the visual component, most of these sensory components have to be autonomic, have to be subconscious, where you're not controlling it, it's just happening on its own normally. And then when an issue does happen, then we have to teach our patients to control it consciously, repeated movements, repeated motions, increase that neuron connections, and then it becomes subconscious. So same thing happens with concussions and the type of issues that happen binocular vision. Subconsciously, the brain has to learn to deal with it. And then now you have the incorrect way of dealing with it. So it's really interesting, but you don't realize when there's an issue how much this takes out of you until it gets corrected and gets treated.
Makes a lot of sense. And when it comes to just vision in general, I've actually had an injury to my optic nerve on the outside. So it was a paintball accident over 8 years ago.
Wow.
And I just don't understand quite the difference between perhaps the optic nerve and the rest of the processing mechanisms, but I've definitely had to compensate due to that paintball injury 8 years ago.
Was it like an actual damage on the optic nerve, like a dog optom? Because for it, the paintball to get to the optic nerve, it has to go through your eye. So it has to enter the
Oh, okay, so no, actually, then it was just on the outside.
yeah.
Uh,
So maybe if we're just on the outside, it can
or,
affect the cornea. It can affect the alignment if it messes with the muscles or the nervous system. And then it can affect the pressure, affect the internal structures of the eye. And consecutively, it can affect the optic nerve. But for it to directly affect the optic nerve, it has to just penetrate the eye, go all the way in the back, and then hit the optic nerve. The optic nerve is more of the sensory output, where you just brain's way of perceiving the information. You have each individual eyes, and then you have the optic nerve that comes in and joins at the chiasm and then splits back. So you have half of the fibers of the eye going from one part of the brain, and then the other half goes to the other part of the brain. And this is like an evolutionary mechanism to protect the person if something happens to one eye, and now they have at least some field of it, with the other part of the brain, etc. So it's taking it in. But then you have all these other nerves, all these other cranial nerves that are contributing to the motor component of your vision. So the optic nerve is the sensory, and the third nerve and the fourth nerve and the sixth nerve, they're the external type of information, the motor component of the nervous system.
it's fascinating how those systems and how incredible the human body really is. And the idea of neuroplasticity was really instrumental in my life's journey and how I recovered because of my brain injury. Didn't have much hope at that time. There was no talk of neuroplasticity.
All right.
There still isn't in the traditional medical system
All
as
right.
much
All right.
as there should be. But I just want to know, like, how has that idea influenced you and in your practice?
So I believe neuroplasticity is present in every individual, regardless of age. Yes, it does get harder, more difficult, and it's a lot more difficult when doing these certain things as we get older. But there's still neuroplasticity in every one of us. So, and it is important. You do need to be able to change these connections in the brain. Really, literally, that's what vision therapy relies on, this neuroplasticity. Because if your brain has learned a certain way to move your eyes, to move your focus, etc., you have to have neuroplasticity to change that. You're like, oh, this is the incorrect mechanism. This is the incorrect adaptation. Can't do that. This is what we're doing. So that involves neuroplasticity to get that done. And I see this in every one of my patients. If you do things right, you see these changes in life. And I've done this in 10-year-olds, and I've done this in 7-year-olds. So it is
It's so
possible.
encouraging. It's so encouraging that we have that adaptation mechanism. And
Yeah.
I want to nerd out a little bit with you when it comes to our brain being a prediction machine. And so this is what I recently learned, and it kind of blew me away. The neuroscientist David Eagleman, he was talking, and maybe I'm going to completely mess this up, but he says visual information comes in and then it bypasses through the brain stem essentially, and then gets fed up through the thalamus. The thalamus determines what is different, what predictions are incorrect, then it sends it to the visual cortex. So that blew me away that essentially our brain it makes predictions about life to make things easier, but then it changes those predictions. And I was like, whoa, like what the heck?
Right. Absolutely true. Because kind of like what we were talking about earlier, how it needs to be subconscious so we can get things done in our lives and not really focus. Same concept. Our brain has to predict these things to make things natural and flow and not for it to interfere with our daily living. So a lot of the times, for example, there's the suppression test where you have the line paper and you draw an X on one side and a target on the other side. And as you're holding in a specific angle, the X falls on your blind spot, your optic nerve, and you don't see it. But what you see is this continuation of these lines, like on the line paper. You still see that line going through it, even though that line is not really there anymore because there's an X there. but your brain fills that up. Your brain fills that up. So there's definitely a predictability to that. The brain's just trying to live life, trying to get you to function in the environment that you're in. So it has to feel these things so you can focus and concentrate on the important things. So yeah, and then I see this with vision in a way that, like suppression, for example, that's another thing that the brain learns to do when you have this issue. You have two informations coming in, like two different perspectives coming in. Let's say one eye is looking somewhere else, and now the brain has to figure out, like, what are we seeing? So what it does, it has to pick an eye. If it looks here, now you're looking at one thing. If it looks with this other eye, it's looking at some other thing. So one of the things that it learns to do, it learns to ignore one eye completely. And then now the brain's paying attention to one eye, and the other side kind of is filled in with whatever you're seeing. So very, very similar concept. And then typically, like when I do these tests in office, patients are mind blown because they're like, oh my God, I had no idea that that's a possibility. I thought I have both eyes open, so I'm taking in information from both eyes. But that's not the case. Actually, a lot of my patients that have these issues are not using both eyes at the same time. So the brain fills in the rest of the information they're seeing, making you think that everything's normal, everything's fine, when in fact, you're really not perceiving information from one of your eyes at the same time as the other one. So it's a really interesting thing that we see, but that's why the brain's so incredible. It just learns to deal with these things on its own. Not the best way, not the right way, but it learns to deal with it the best way it can.
Gets the job done.
Right, exactly.
Yeah. And what are a few things that you wish more people knew, but also at the same time, what are some things that you wish people kind of didn't know, if that makes sense?
So I actually post a lot of that. Like I wish more people knew like the video content. So
Yeah.
more people knew that a lot of the behavioral issues that we see in the medical field, a lot of the mental health conditions that we see in the medical field, a lot of it have to do with our eyes, with the way we're perceiving our vision. And not the 20/20, not that one function that every doctor tests. That's one out of the 17 visual functions that we need. But the rest of the functions that are not working well, and then now the eyes are all over the place, they can't focus, they're getting pain, so it causes mental health issues. In fact, there was research on it. I don't remember this research myself, but I've heard about it, I've talked about it with others, that there is not a single case of schizophrenia where the patient was born blind.
Wow.
So not a single case of that. So that's a very interesting thing. And I truly believe a lot of mental health issues are undiagnosed binocular vision issues. And the reason why I'm saying that is because I'm seeing these life-changing experiences in my patients after correcting. I've just seen this in the last 10 years. I've had patients with diagnosed ADHD even say that I'm not taking any medications anymore after having these visual issues gone. I've had patients that were on depression. They were constantly feeling these really horrible feelings that they couldn't get out of. So a lot of behavioral and mental health conditions are likely undiagnosed binocular vision issues. And then what I wish people didn't know is that like just focusing on how important 20/20 vision is, because it's not. It's really not. I have patients that come in, they can't see the biggie on the chart. I asked them, do you have any complaints about your vision, your life, about any difficulties? None. And then I have patients with perfect 20/20 vision that come in with the slightest little micro misalignment, and they're having every one of these concussion symptoms. They're getting dizzy, they're getting nauseous, they're getting migraines. Yet, because the visual acuity is more important in our system, they're like, no, I got my eyes checked, I have 20/20 vision. My doctor said, nope, your eyes are perfect, you got 20/20 vision. So if more people understood that there's a lot to it than having 20/20 vision, then there'll be more testing, more education, more research in that field, and trying to help more. But of course, nobody really wants that, because how are we going to sell these medications and all these other treatments? So yeah, I really wish we could do more into that field, and maybe we will over time.
And I bet you will. And especially with the times we're living in, I think everybody can agree they're kind of chaotic these days, and there's rapid things going on every day. I wonder how like artificial intelligence would kind of work into this and perhaps, making your mission get out there more.
Yeah, I'm really hoping to somehow, some way implement like some system where patient tells us symptoms, we add a few findings to the exam, and then it brings in like a specific diagnosis or something like that. That would be really helpful, or some kind of a system that other doctors can implement in their office that based on these findings or symptoms, they can look into specific testing and then help patients out. So that's the main thing. I use AI in my life, in my business quite a lot, and I use it for all kinds of reasons, but mostly with generating content and kind of spreading the word out. But yeah, I think it's gonna be like incredible bringing it in. As simple as like the eye tracking system we have. We have a VR eye tracking where it records the eye movements and then it shows us on a graph where the target is versus where the eyes are. If we could implement an AI system into that, it could analyze the recordings and tell us that this is the eye muscles that are involved, this is the cranial nerves that are involved, these are the functions that are involved. Treat A, B, and C at these exercises. Like there's so much that can be done, and
There
so I'm excited for it. I'm not one of those people that's like afraid of it, hates it, talks down. No, no, no. Technology, anytime technology is changing, you got to keep up,
you
and
got to embrace it. Yeah.
you got to embrace it. Yeah, you're one person against the world. You can't do nothing.
Yeah. Yeah.
And you always have those people like with the cell phones they came on, like these new technologies that are coming on. You gotta have the people that can adapt to it. But I think it's a very important evolutionary trait for us to be able to adapt to changes in technology that are happening so quickly. So yeah, it'd be great if we could incorporate that in our systems.
Other than concussions, like what are other common reasons for BVD?
The most common reason I've seen has been genetic. Like there's got to be a genetic component, something with where the muscles are attached, cranial nerves, asymmetry, like facial asymmetry, for example. One eye's higher, one eye's lower. That's already going to put a strain on some of the muscles and not others. That's going to already create an imbalance between the neurovisual system and create issues. So biggest thing, genetic. It's very common in connective tissue disorders because the same connective tissue that exists in our body, it's on our eye muscles where before it attaches to the eye. So if you have weak connective tissue, you're gonna have weak eye control. And if you have weak eye control, you're gonna have focusing issues, you're gonna have spatial issues, balance issues, dizziness, etc. Because your brain's not gonna be able to coordinate the two eyes and then fuse them into a single image. Trauma. We talk about concussions, but any kind of trauma to the eye muscles, car accidents, falls. I've seen that happen. Drastic hormonal changes. Most of my followers and patients are female. So drastic hormonal changes can cause physical changes in your neurovisual functions. For example, thyroid. If there is a drastic change in thyroid hormones, the thyroid hormones themselves flood the ocular system and get into the extraocular muscles, fatten the muscles, and then you'll see the eyes bulging out. That's exactly how the bulging out happens. It's this muscles getting fat and then pushing the eye forward. So drastic hormonal changes, very common. I've seen patients that had these symptoms, pregnancy, after having a child, menopause, even the monthly symptoms that they get. Like some patients just get migraines during the time of the month. And it's these, like, I see this direct impact of these hormonal changes that are happening in the visual functions. But yeah, those are the main things. But the number one, genetics.
Got it.
Yeah.
Have you ever considered working with elite athletes, like on elite vision or anything of that nature? Is that you have any passion for that?
Absolutely. I myself weren't into sports as much because of my own issues.
Yeah.
With binocular vision dysfunction, you can't throw straight, you can't catch straight, you can't even run straight. And you can't definitely do all of those things at once when you're in the middle of a sport and you're being attacked by all these different players at the same time. So sports and I did not really mix growing up. Now, where I have all these issues kind of treated myself, I'm able to go back and kind of introduce myself again and try these things that I could never do. So not something I'm very passionate about, but I would love to get into it. And I believe improving binocular vision is like the key to excelling in any part of life, and definitely sports, like huge. For you to be able to perceive the player coming one way and you still have to go this way and be able to maneuver yourself, like for example during football, it requires so many functions working in at the same time perfectly for that to happen. So training these skills in athletes will make a dramatic change in these functions. And in fact, there are a lot of athletes that are already incorporating vision therapy exercises into their daily routine and seeing these changes happen in real life.
Absolutely, that's wonderful. Something I'm passionate about, and because I feel like you and I are both high performers in our own sense, you know, business owners and stuff like that. But um, just speaking to, if you could just speak to like one person who, just imagine you're speaking to one person who typically comes in your office who's struggling. What would that conversation look like, and what were those encouraging words that you would tell them?
So, I mean, when patient comes in, to be honest with you, they've already seen a lot of the social media stuff. In fact, many of my patients are like, I've been watching your stuff for like 2 years, and I just couldn't get myself, like, it didn't hit, and then I was like, all right, it's time to come in. And when they come in, they just want to be acknowledged most of the time because every single doctor and specialist they had seen up to that point had told them that everything is absolutely perfect. Eyes are fine.
Can I stop you there for 1 second?
Yeah,
Because it was the opposite for me. It was everything is awful, accept it. And now you're telling me like everything is perfect. And
yeah,
that is going to be its own hell in its own way.
yeah. Majority of the patients I see, they're like, I've seen every single doctor you can name in the book. I've seen a neurologist, an ENT, a PT, a vestibular specialist. I've done all these exercises. I'm still symptomatic. And all they really looking for is, I completely understand. Yes, these are happening because of your eyes, because they themselves are experiencing these visual issues. But they go tell a doctor, the doctor does the routine texting, and then they're like, no, your eyes are fine. So imagine how that could make a patient feel, a person feel. You're experiencing this in your head, yet somebody else is telling you that it's not. Like this is
Well,
not real, and it's in your head. So this conversation is just like, oh yeah, I definitely see it. I notice these even just postural changes, these facial changes, like expressions, and just bringing it out and talking to the patient. They're just like so calming for on the patient side of things. And then I'm like, we'll take care of it. We'll do the proper testing. I'm very comprehensive. I do at least like 10 different tests in a matter of like an hour, and I do manual and virtual reality type of recordings. And we look at depth perception, spatial perception, and throughout this testing, I talked to them all these difficult scenarios that this would cause in them, and every single kind of thing that we talk about, you can see the light bulb just popping up. They're like, oh my God, yeah, I had these difficulties growing up. I thought that was just me. So it just feels really amazing on the patient's side of things to be able to be heard and then be like, yep, this is something that's happening in your visual system. This is something I can help you with, and it's just going to get better from that point on. And it does. That's the crazy thing. I've seen these changes on a daily basis, and it just requires time. So as long as I talk to my patients and we have a great understanding that this exists, this is going to take time. You just have to be patient. You have to go through these changes until it gets better. It's really an amazing experience.
Um,
Uh,
uh, thank you for sharing that. And it is so important that we help people wherever they are in life feel seen and heard. It's just so important
Absolutely.
as human beings we have more compassion for one another. Uh, let's a few ending questions is what would you what would you like to see 5, 10 years from now, where you are in your practice and where you're going with this mission?
So I want to teach this to others. So I'm able to help maybe 10 patients a day right now, and I feel like we can do more. And not me personally, because you have to take each test for now, it takes an hour to do. So I'm not really able to help many patients in this situation. But if I teach other doctors and if I, teach these skills, teach these things that I've learned in my own experiences, seeing my patients, it will help many more patients get properly diagnosed and treated. So in 5 to 10 years, I see myself maybe seeing my original patients that I love and I'm, feel connected to maybe 1-2 days a week type of basis. And
Yeah.
then most of the days is just working on getting the word out, teaching other doctors how to implement these tests in their own practice, and teaching these different types of treatments that the doctors can administer for patients and the corrections to kind of help spread that change everywhere across the world. And in fact, now I'm getting just flooding of comments and questions and emails and calls from all over the world, that I've been having these symptoms my whole life, for 10 years, for 20 years. And in fact, many of our patients do fly in for an in-person evaluation. We actually have a map in the office where we have patients pinned
Yeah, I
for
saw that. Yeah.
and it's crazy. So my goal and my passion would be to, in like 5-10 years, go all over the world and teach doctors, societies, areas of, this exists. Vision is more than 20/20. There are a lot of functional vision things that should be measured, and that's more of a predictor of the quality of life for the patient rather than, oh, you got 20/20 vision. So that's the goal. That's the plan.
Would you be thinking of mostly educating like ophthalmologists and optometrists
Yeah.
first? Yeah.
Yes, optometrists, ophthalmologists first. In fact, I think before getting this out there, because I believe majority of the population has some form of asymmetry or misalignment or some kind of binocular vision dysfunction that they're compensating. Because I see it in my practice. 8 out of the 10 patients I see have some form of these symptoms and some form of these findings. So first step is correcting this issue in the doctors themselves, which is what happened to me. I corrected my own issue, blew my mind of how differently I'm seeing, and now I'm obsessed and I'm trying to do the same for others. So first step, correcting the doctors, improving
Ironically, right?
yeah, improving their own visual functions, them seeing the difference, and then them getting interested and motivated to implement this into their own practice and getting the word out there. But I also do get a lot of referrals from other professionals. So teaching physical therapists, teaching occupational therapists, teaching vestibular therapists, like all these different important visual components that should be assessed and analyzed and treated before the patient can recover.
Fantastic.
Yeah.
Well, thank you so much for coming on, Dr. David. It was an awesome conversation, and I just want to leave you with the last word, but as well as where people can find you and reach out to you as well.
Yeah, so we're on every single social media, like the popular ones that you can think of. It's easy to find Vivid Visions Optometry, and yeah, just I try to post daily content, spreading awareness. I talk about symptoms. I post patient testimonials, the map where our patients are pinning, and yeah, if you have these symptoms, these headaches, migraines, anxiety, panic attacks, dyslexia, ADHD, focusing issues, clumsy, like there's a huge list. Just learning about it on social media, recognizing the symptoms will really help you understand your own life. And then if you have the proper resources, the time, the means to actually get out here and get the evaluation done, that'd be the best thing you can do for yourself. And it was the best thing that I did for myself. The fact that I'm able to have a full office, have staff, have a family, go home and spend time with my kids, it's thanks to my own issues being corrected. I used to crash at like 10 a.m. I would wake up at 8, crash at 10, at 12. It's just extremely difficult to get through the day. And now, I'm able to run a whole practice and live my life. So that's that last word I want to get out there. If you have any of these difficulties, getting this issue corrected will drastically change your life.
Amazing comeback story. I love it so much.
It's a really quick and easy test you can do for yourself, family members, patients that have these symptoms that I've talked about. Like a simple look at something and you switch between your eyes.
Okay.
So like look at your finger, yeah, keep your head straight. So pick a target. And by the way, this could be different depending on the gaze, like the direction and distance you're looking into, because a lot of these misalignments are gaze dependent. Like some people have reading issues, but no problems driving, and vice versa. So you would pick a target. So this would pinpoint the near issues that can happen. And then just look at your finger, soft gaze, face relaxed, look at where your finger is, and then you switch. And if you have this issue, your finger will jump. And the comments and the remarks that I hear from people and patients is just insane. And then makes you realize that how many people are closing an eye throughout the day and understanding what they're seeing. many of them had no idea that they're actually not seeing this target in the same spot at the same time. So that's a quick test you can do. And I can actually help you understand what you're seeing if you want to do it right now real quick.
Absolutely, yeah, I'm all for it.
Look at your thumb and switch between your eyes and tell me what kind of a jump you see. You're looking for a jump in your vision. You
Oh,
notice a jump in your finger position?
yes, I do.
Yeah, so you shouldn't have a jump because your finger stays in the same spot in space. Right? It didn't change spatial positions, but you're seeing a change in the spatial position of where your finger is.
Yes, I do see a change.
Is one higher?
So when I go from right to left,
Yeah, I suspect your right eye would be higher.
yeah, when I go left or right, not a substantial jump. It jumps a little bit that way, but then when I go, when I go left to right, it jumps from left to right, and when I go right to left, it jumps from right to left.
So right to left, and then it goes to the left. Okay, so that means you have it's called an axial deviation. These are kind of pointing a little bit further out from one another than aligned. And then if you notice one is higher than the other one, then that means your eye is physically pointing lower than your other eye. Try to do a little bit faster. Go like this. Like hold it by your nose almost, and then just switch back and forth. Is one slightly higher, like your right eye's image?
Something's definitely going on there, yeah.
So what you should be seeing ideally is your thumb, right? It's in dead center, and you should see like a right angle perspective. Think of them two cameras, and they're recording a scene. So you should see right angle perspective and a left angle perspective. But your finger should not change spatial positions.
Thank you, everybody that's listening, and you all have a great rest of your day.
Thank you. You too as well. Appreciate this talk.